Hello, everyone. Professor Zeeb here, and welcome to our audiovisual lecture. We're going to talk about Chapter 3. We're going to kick it off with infancy here. And what we're going to cover in this particular video, what I'm going to teach you, is basically some of the highlights of physical development of infants, and then as well as some of their nutritional concerns, okay? So remember, when we're talking infancy, the age range here is basically birth to about age 2. So that's kind of what we're looking at here. So let's go to our slides. All right, so infancy, this is from chapter 3, part 1. So we're going to look at the physical development of infants. Remember, age frame here is birth to about age 2, okay? If we had to kind of put it bluntly, infancy is a time of rapid physical and nervous system development. I mean, things just take off completely rapidly during this stage when we compare it to other life stages after birth, okay? So let's give you some statistics here. So our average newborn here, born in the United States, is about 7.5 pounds and about 20 inches in length. So we would sort of expect that. After 1 year, you guys ready for this? Just to kind of show you how fast things happen. After about a year or so, their weight will nearly triple. Can you imagine tripling your weight in 1 year, which is incredible. And the length increases by about 40%. So they've estimated about 3/4 of an inch every month, which is absolutely amazing in how fast it actually happens. I want to show you some data here on our next slide. So this kind of shows you how quickly things happen, especially during that first year. So down here, we have our age in years up to about 3. And then we have inches on this side, and of course, pounds over here on the right. So if you look at that first year, look at these massive gains in both height and weight. We see some really sharp inclines during that time. And then after a year, things are still happening pretty quickly, but they start to somewhat level off. So I mean, really that first year, it's just incredibly fast how fast they develop physically in terms of height and weight. We're also going to see some changes in body composition and proportions. So I love this next slide. This one's always kind of fun the first time you see it. And it shows the different body proportions of the different life stages. So if you look at this first one, 2 months, it almost looks like something alien here, but look how big the head is compared to the rest of the body, about half of the body length. So to take it to our stage here in newborns, we're going to find that the head is about 1/4 of the body length. So that's pretty incredible to think that your head is about 1/4 of your whole body. So we think infants, it's approximately that. And then, of course, during adulthood, it'll be about 1/7. So eventually it's going to sort of catch up, so to speak. But if we look at our proportions here in that first year or so of life, we see some really misproportions where the head is absolutely enormous. One of the reasons for this is that different cells and tissues grow at different rates. So eventually it's all going to catch up, as we said, but we do see those differences early on. You also have to imagine or understand that during infancy, it's a time of extreme vulnerability. It's one of our most vulnerable life stages after birth. In fact, some of the research is showing it has one of the highest mortality rates of any of the life stages that we're going to talk about in this class. So we know that it's a very sensitive time, and we're often susceptible to different type problems that we're going to cover through the course in the chapter, okay? So now we're going to transition into the nutritional needs of an infant. So this first point is obvious. Nutrition is a key element for a healthy infant. I mean, that's obviously, you don't need me to tell you or anything like that, but there it is. In fact, nutrition, we're going to find, is an important factor for any stage that we talk about in a class like this, going all the way up to older adulthood. So nutrition is going to be huge at any stage, but certainly for an infant. For example, if certain nutrients are not present in an infant's diet, if they're not present in required amounts, it can actually affect their growth rates, as we've found. So nutrition is going to be very vital for many different areas of the body. So what we're going to focus on in this next bit is breastfeeding. When we research this stuff here in the United States, we find that a lot of parents are opting to breastfeed their children. Those numbers have been going up. I think it's pretty obvious why, and we're going to cover some different reasons why parents opt for this or why possibly they don't. But a lot of research is showing, in fact, a lot of professionals agree that breast milk, depending on mom's diet and lifestyle, for example, is the perfect balance of nutrients that an infant needs. So in terms of fats and proteins, it's almost like nature's perfect recipe for what a developing infant would need. So in my opinion, I want to encourage you to breastfeed your infants. Now, obviously, I can't tell you to do that. It's a personal choice for obvious reasons, but from all my experience and background and my knowledge, we are seeing a lot of benefits of breastfeeding. So I really want to encourage our mothers out there, or mothers-to-be out there, to really consider this, because we know it's an important one with a lot of benefits, and we're going to look at that. You know, some people argue that breastfeeding helps to fight against obesity. Some studies are showing that it may increase cognitive skills, including intelligence. And we also know when we compare breastfed infants to those who are not, on average, they tend to be leaner. So once again, in a society that seems to really be battling obesity, that's important news. So we're going to look at some specific reasons here why potentially you would breastfeed your child. So we're actually going to compare breastfeeding and bottle feeding, because obviously as a parent you have that choice, that personal choice. And so let's kind of look at these. We'll start with the advantages of breastfeeding your child, and there's quite a few here. To me, one of the most important ones, the ones that really, seems to be obvious and come up a lot in the studies, are that, breastfeeding helps protect against disease. One of the reasons we think that is that it contains antibodies. And as most of you probably know, antibodies help fight against infection. Okay, so that's a big reason that people often cite when they explain why they're breastfeeding. Secondly, lesser degree of illness. So we know that breastfed infants may have a lesser degree of illness. For the longest time, they were telling us that in terms of an allergic reaction to it as well, that it was sort of leaning more on the breastfeeding side, that it was better. Recent research, however, is showing that it's not really associated with the lower risk of allergies. So there's a lot of controversy about that one, and it seems like the research is sort of slowly changing. But when I first started teaching this class, the research is kind of pointing towards improvement in allergies. Lower hospitalization rate, which basically is translating into better health. We know that infants who are breastfed have stronger bones, have a lower risk for obesity, for example. And as we even said before, there are some studies that show it may advance cognitive skills. So the point is, all of that sort of painting a picture of a better healthy infant, and that may be a prime reason why people are opting to breastfeed their infants. Less diarrhea and constipation. Well, obviously, not only is that good for the child, but that is a bonus and plus for the parents out there who are changing the diapers, of course. But furthermore, less chance of urinary tract infection. So that's good for both parent and child. A lot of good benefits there. Psychologically, we know that breastfeeding encourages mother-infant bonding in a way that as a male, I can't even imagine. So obviously as a male, I can't tell you what my experiences are with this, but I can tell you the people I know that have done this, including my wife and with our children, is that it does promote a lot of emotional bonding. So there's really nothing probably that compares to that. That's obviously going to be huge. There are some studies that show a reduced risk of SIDS, sudden infant death syndrome is what that stands for. Okay, so obviously SIDS is a really devastating thing that any parent would go through. And of course, we're going to talk about this in the course, but we've seen some studies showing reduced risk of SIDS. Not only is breastfeeding good for the child, as we've said in many different ways here. In terms of mom, we have found that women who breastfeed have a lower risk of breast cancer, as well as a lower risk of ovarian cancer. So that's kind of promising to know that not only potentially does it benefit the child, but also the mother. Unfortunately, not everyone can breastfeed. There are some reasons why some people may opt not to or potentially can't. So I want to make sure that we do cover that because it's not always an option for everyone. For example, if there are pesticides in mom's environment, in other words, maybe she was exposed to some kind of chemical or pesticide. A lot of other countries have different guidelines about this. So the point is that we think those chemicals may be passing into the breast milk and obviously could be dangerous. Some women cannot produce milk for various reasons. So maybe it's just a production type problem. Some women report that it's very painful. I remember my wife talking about this. So sometimes breasts become inflamed or cracked, nipples become cracked, and it's just too painful to bear. Excuse me. So in that sense, they may opt for bottle feeding. Sometimes it may be sort of a reflexive action on the infant's part where they simply cannot suck vigorously enough. Infants come with this inborn reflex, the sucking reflex, which helps them to feed. And sometimes that may not be strong enough to stimulate lactation and that kind of thing. And so therefore it creates problems. So that may be another reason. Of course, some women do choose, or families choose formula milk over breast milk. So it could be a personal choice that they're making this decision. Okay, so let's kind of look at some other reasons. So disease would be another one. If mom had, for example, AIDS or tuberculosis as an example, we know that sometimes that can pass through breast milk. So that may not be an option for those particular mothers because they're trying to avoid that, obviously. Okay, so let's look at the advantages of formula feeding. Okay. One of the most common reasons why people say formula is better is that dad, or anyone else for that matter, can actually feed the infant and they can participate in this wonderful experience of feeding an infant, which once again is an exceptional experience. I think the counter to that, however, would be obviously women can pump milk and freeze it and store it for later use, and therefore dad or anyone else could partake. So once again, that's a reason that's commonly cited, but you could actually argue against that. Some people believe that formula contains more proteins than breast milk. So in terms of that factor, it may be a little bit better for the infant. But remember, my personal opinion, the research I've seen is that if we have a healthy mother with a healthy lifestyle, breast milk, once again, is nature's perfect recipe, and nothing really beats that, in my opinion. However, some of the people that are on the formula feeding side often cite this reason. Some other reasons why someone may not want to breastfeed their infant is that maybe they're a substance abuser, or it could be cultural reasons or traditional reasons. And like we said, disease is often a cited reason why breastfeeding may not be an option. So it turns out that a lot of the studies are showing a lot more benefit from breastfeeding versus formula. However, I want to give you both sides of the fence here. You have to realize that the studies that show the advantages of breastfeeding are correlational in nature. So if you guys remember when we talked about that in class, or if you've read that in the chapter, that correlation is not causation. And that does not specifically mean that breast milk causes an infant to become healthier. Okay, so I don't want you to think that. We just know that it's correlated. We see this trend where there's a pattern when we compare breastfeeding to, say, formula feeding. It seems to be more beneficial, but however, that data is correlational. Some of the critics are going to say that, well, the people who are breastfeeding and participate in these studies typically are older, possibly more educated, they are wealthier and thus are more health conscious. That's a great point. Maybe the people that are participating in these studies are the ones that we show the benefits in have all this other stuff going on. You know, they're more educated about certain things that are bad for you. They have access to great health sources. You know, maybe they're a little bit more health conscious than the average person. So you have to kind of think about that with these studies. Even though we see a lot of these benefits and you know, they come up again and again, it may be you know, by a sample, as we've just described, and also it may be correlational in nature. So I will let you make up your own mind, but once again, in my professional opinion, I believe that breastfeeding is really a great option for parents, and it really benefits the child's developmental course. So that's an important thing to think about. All right, so this will conclude our short lecture here on the physical development of infants, including feeding options, and we'll see you in class or online.